Hello. So somebody at the Academy of Acupuncture said that they noticed that all the heart and gallbladder herbs are cool and cold. Does that reveal anything about their relationship? Yes, it definitely does. That is emphasizing what I'm talking about the extra strong fu aspect that the gallbladder has with the heart. And with the heart, most of the time, we're going to be channeling heat away from the heart. That's usually when they're talking about pathologies. Most of those are going to be external invasion herbs too, right? So that's part of that situation. Um, uh, so again, sometimes we might want to use the tropisms of those herbs to help us to get the cold stagnation out too. But for the most part, they're talking about treating heat diseases and somehow getting the attack of the heat away from the heart. So that's how they're mobilizing the gallbladder as a very potent food for the heart in that way. So it's a really good question. Okay. All righty. Where are we heading from here? Okay, we're getting back into our liver pericardium name relationship herbs. Okay, so one of the reasons why we're doing this is to give you an idea of all the different ways that we can use this name relationship. Okay, so it's important to look at the range of possibilities. What we can do with each of these relationships is very strong. So one of the things we can do with this relationship is we can calm the liver and extinguish wind with something like digesture. Okay, which is bitter and cold. Okay, goes through the heart channel. Okay, same channels like Danshen when we were looking at Danshen earlier, right? Heart, liver, and pericardium. Right, so remember it's got that little extra dangling heart tropism there, huh? So it's kind of like Danshen, but it's colder. And because of that extra coldness, it's going to be using, remember, the liver, that internal wind, right? So it's talking about the liver wind. The bitter and the coldness is suppressing that liver wind, okay? Plus it's a metal, the hematite, right? It's a metal, and so it's going to be, or a mineral rather. So it's going to be, all the minerals are somewhat suppressive of the wind, like that, okay? So anyway, we're starting to make apple-to-apple comparisons when we do it in this way, when we really break down the channels and look at the channels for what they are. We look at the temperatures, for what they are, and we look at the tastes and see what those are about also, right? So this is how we really begin to differentiate, is by making meaningful and logical comparisons, okay, instead of doing it by symptom. It doesn't make any sense at all to do these things by symptoms, okay? So here we go. Along those lines, let's take a look at another herb, same channel tropisms, right? Gotong. This one is sweet and cold. In the liver, the pericardium, and the heart. So maybe it's the coolness and the coldness that are helping to bring down and extinguish that liver wind. So we would think that that internal wind maybe is related to the heat somehow. Probably, if you look at these things, but it's definitely related with the liver and pericardium and the heart channels, like that, okay? So Gotong is similar to Danshen and Daijia, but now it's using sweet rather than bitter. So it's a different kind of a control mechanism, okay? So the sweetness, maybe it's going to help control the vessels a little bit. Maybe it's going to oppose the Jue Yin a little bit, okay? Maybe it's going to moisten and consolidate the Jue Yin. Maybe those are the same thing. I don't know. These are all possibilities, okay? And these are the kinds of questions that studying herbs leads us into, okay? So it's a kind of a process that takes us directly into deeper understanding, not just of the herbs, okay, but of all the different mechanisms that are at play within our bodies, all these different control and support mechanisms, huh? It's very complicated. And so the herbs help us to understand, wow, what is that? What is it here between these three different herbs? Like the Danshen, Let's see. Here I can pull up Danshen too, and we can look at it right here. Okay, so we can make some meaningful comparisons here. Okay, so when we start looking at these herbs, so what are the differences? Okay, we're talking about one kind of mechanism here. Up here in Danshen, we're just focusing mostly on transforming the blood. Okay, so we got bitter and cool, cold, even warm. There's like a whole range of temperatures possibly with Danshen here, but it is bitter. Okay, but then we got Daizashir, which is definitely cold, but doing the same thing, right? But now we're talking about calming the liver and extinguishing wind. Well, does that have something to do with vitalizing the blood and transforming stasis? Well, they're related, right? Because these spasms in the vessels, okay? That's what's going on, okay? And then we start doing it with the sweet. It's a totally different idea. Hmm? Hmm? Well, we know that go tongue is related with the wind and capturing wind, remember, because we talked about that in our first class, that anything that has hooks and thorns, right, relates to the wind, hooks, it hooks the wind, or piercing things relate to the wind. It's another way to look at it, okay? So again, apple to apple comparisons, we always want to do that. Okay, so let's see where this progression of herbs takes us, okay? Here's another herb that we looked at yesterday. Lujiao Shuang, right? Liver, pericardium, heart and kidney. Okay, we visited that with another herb. We had a heart kidney herb in there before. Okay, so there's another one that's like that. Okay, this is slightly warm, sweet and salty and astringent. Sweet, salty and astringent with this one. Okay, so what kind of an effect is that going to have? Okay, so it's going to support, it's going to consolidate the Jueyin and the Shaoyin systems. Okay, it roots the Jueyin back into Shaoyin, and it dissolves accumulations along the way. This is a super interesting herb. It can do all that consolidation, but it's also dissolving accumulations at the same time. Very interesting. Okay, so here we come back to Jueyin Shaoyin again. Oh, this is Danpi we were talking about before, right? Okay, but now it's doing something completely different than Lu Jiao Shuang. Okay, so here we're back to bitter. And so there's difference between the sweet and the bitter, and then you got the salty with the Lu Jiao Shuang also, right? So very, very, very different effects. Okay, this is more of the vitalizing blood with the Danpi. So what kind of an effect is Danpi going to have? It's going to activate, cool, disperse, clean toxin from Jueyin and Shaoyin systems. Okay, when would we use one? When would we use the other? What would happen if you use them together? Okay, we'd have stronger effects on both of these systems, and it would emphasize their name relationship. Okay, would emphasize that name relationship a lot. Okay, they could help to balance each other and synergize each other's effects. Okay, Danpi can conduct some of the heat and the irritation down to help everything flow and assimilate better. Okay, and the Lu Jiao Shuang, it could help to support while adding some of the cleaning effects of the Danpi. Okay, okay, that would help that dissolving process probably. Okay, so those are all of our choices for liver pericardium name relationship herbs. Okay, so all of them together form a kind of emergent system. So remember, P1 plus all of these herbs is an emergent system. Okay, so that's one you're going to want to become familiar with so you can begin to understand these tools that we have to work in this territory. Okay, that's it for that one. That's one relationship down. Okay, one relationship down. So let's keep going. Here we go. I have nothing to share there right now. Let's go into our next liver system. Get out your pen and paper, and your pencils again, okay? And we're going to draw that liver channel again, this time a little bit faster and hopefully a little bit differently, okay? We're going to be comparing the liver and the large intestine. This is our Biajing relationship now, all right? So get ready to draw, get out that paper, okay? Start drawing at 1, go up the dorsum of the foot, liver 4, keep going up to spleen 6, up the medial aspect of the lower leg, okay? Remember, you're going to cross that spleen channel 8 above the medial malleolus, okay? Going posterior to the spleen, up the medial aspect of the thigh, up into the pubic hairy region. Go into the inguinal groove, spleen 12 and 13, or 13 and 12, right? Around that way. Curve around the genitals, go into the lower abdomen. Meet the Ren channel at Ren 2, Ren 3, and Ren 4. Curve around the stomach, enter the liver, and network with the gallbladder, okay? So this connection and the network is very different, and I hope you guys understand that herbs channels network with their food partner, which means that it disperses through the whole thing. Okay, so this is the difference between entering and networking with. Okay, where were we? Okay, so we were networking with the gallbladder, then make that line come up through the diaphragm, spread around the hypochondrium and the costal region, connect up into the throat and the neck, posterior to the pharynx. Enter that nasopharynx, connect it with the tissue surrounding the eye and the eye system. Okay, and then coming out across the forehead to meet up with the Du channel at Du 20. And then a branch descends from the eye into the cheek, curves around the lips. Another branch separates in the liver, comes through the diaphragm, comes into the lungs, connects with the lung channel. And then let's go real quickly from liver 5 up the middle aspect of the lower leg, connecting with the gallbladder channel and ascending into the genitals. Okay, and then that divergent channel diverges somewhere in the foot, rises up into the pubis, connects with the gallbladder channel in the pubic area. Okay, and then the muscle channel, again, starts at the dorsum of the big toe, all the way up the leg and ends in the genitals. Okay. Now on that piece of paper, you got to find the radial side of the tip of the index finger. So orient yourself in space. Large intestine 1. Okay, and then draw a line up the medial side of that index finger, going up in between the first and second metacarpal bones, okay, through Hagu, okay, passing between those tendons, the pollicus longus and brevis at the wrist, okay, go up the forearm, anterior lateral side of the upper arm, all the way to the shoulder joint to large intestine 15. Then cross behind the shoulder, okay, following that anterior margin of the acromion, connect up with Da Jue at the 7th cervical and 1st thoracic vertebra, okay? Then draw that line coming through the supraclavicular fossa to network with the lungs, pass through the diaphragm and enter the large intestine. Okay. Then another branch comes from the supraclavicular fossa along the SCM muscle to go into the lower jaw, the gum and the teeth, and connect with the stomach channel at stomach 5. It curves around the mouth, crossing over the other channel at Du 26 to connect with the stomach channel at the side of the nose. Okay. And another branch comes from somewhere in the abdomen and goes down to stomach 37, which is the lower hub point of the large intestine. Okay. Now the low channel starts at large intestine 6, so find that on your drawing. Okay. And it joins the lung channel 3 cun above the wrist at marijuana lung 7. Okay. comes up the arm, through large intestine 15 at the shoulder, goes into the jaw and the cheek at stomach 5. And one branch goes into the teeth and the other goes and connects, remember, with the ancestral vessel in the region of the ear at Sanjiao 22. So there's a connection between the large intestine and the Sanjiao. You tell us what balanced relationship that is, and I will give you a nickel, right? Okay, what about the divergent channel? Diverges from somewhere in the hand. Goes up to large intestine 15. Draw it quickly and goes into the breast, okay? And a branch cuts off from there at the top of the shoulder and goes and enters the spine at the nape of the neck. Joins with the large intestine and the lungs, crosses the supraclavicular fossa. Okay, another branch ascends from the shoulder to the throat and the neck, along the throat. Again, going into the supraclavicular fossa and coming back together again with its own channel. And another branch descends from the clavicle and connects with the lungs and large intestine. And the muscle channel just goes from large intestine 1 all the way up into the neck, but then it goes up into the corner of the forehead, okay? And then goes all the way up to the top of the head, and it crosses completely over the other side to connect with the mandible on the other side, okay? And another branch of that muscle channel goes from the shoulder over the shoulder bone and across the scapula and connects with the upper thoracic, okay? And another branch arises in the neck and goes through the cheek and converges in the cheekbone. So I want you to take a look at that piece of paper. Just take a look at it for a moment. What are the relationships between the large intestine and the liver? What are those relationships there? What can you see? Just from what you drew, what can you see? Okay. Well, we know that the liver flows from the feet into the chest. Okay. And the large intestine flows from the hands into the head. So both those channels are bringing energy into the body. Okay, one into the chest and the other into the head. Okay, even though we would think of one as a fu and the other as a zang, they're actually both bringing energy into the body. Both begin in the extremities and flow into the body, okay? Okay, there are definite parallels in the mirroring between Hegu and Taichung, if you look at them, okay? There are also parallels between liver 4 and large intestine 5. The same point, right? Okay, then it breaks out into the medial yin aspect of the leg and the anterior yang aspect of the arm. So then it switches once you get into the arm or the leg. The large intestine takes an extra trip when it crosses behind the shoulder, okay? It goes all around the acromion and connects with Dajue up in there. So that may be similar to the liver channel curving around the genitals, okay? So large intestine goes up, connects over like that, and the liver channel goes up, curves around the genitals. So that's a similarity right there, okay? Large intestine descends through the supraclavicular fossa to go and network with the lungs and pass through the diaphragm, go into the large intestine. And the liver goes into the lower abdomen, connects with Ren 2 and Ren 3 and Ren 4, right? Curves around the stomach, enters the liver and networks with that gallbladder. So we have one descending and one ascending through mirroring areas. Okay, then the liver ascends through the diaphragm and spreads through the hypochondrium and the costal region. Okay, so there's a contrary motion and a convergence between the liver moving up through the abdomen and the chest and the large intestine descending through the chest and the abdomen. So they have a contrary motion. Okay. They go opposite directions through the diaphragm. Okay. And the liver connects with the throat and the neck, posterior to the pharynx, enters the nasopharynx, and connects with the tissue surrounding the eye and the eye system. Okay. Then it emerges from and ascends across the forehead and meets the Du channel at Baihui. Okay, and then there's that branch that goes from the eye system and it goes into the cheek and curves around the lips. All right. But the large intestine comes from the supraclavicular fossa. Along that SCM muscle, it goes into the lower jaw, the gum and the teeth, and it connects with the foot Yangming stomach channel at stomach 5. Okay, but then it also curves around the mouth. Okay, and crosses over its other channel at 226 right in there, to connect with the ren. So remarkably, they actually mirror each other in the areas of the throat and the sinuses in the mouth and the eyes. They don't actually converge, but they kind of hold the space between them. And a branch of the liver separates in the liver, crosses and passes through the diaphragm and reaches and goes into the lungs. And a branch of the large intestine directly joins the stomach somewhere. Okay, so that lung and the stomach, okay, when we hear lung stomach, we want to think of the end of the liver and the large intestine channels whenever we hear lung stomach, okay? Because it's in that area, okay? Now with the liver low separates at liver 5, okay, on the leg there, then connects with the gallbladder, goes up into the genitals, and the large intestine low separates from large intestine 6, okay, and joins the hand lung channel, 3 tun above the wrist, okay, at that marijuana lung 7 point, okay, goes up through the arm, through large intestine 15. There's a bunch of stuff that goes through this area of the large intestine 15. It's a very important convergence point. Okay. Okay, so then it enters the jaw and cheek, stomach 5. One branch goes into the teeth, the other one goes and connects with that ancestral vessel. So the liver connects with the pelvis and the genitals, okay? And the large intestine goes up through the shoulders, the jaw, the teeth, and the ancestral vessel, okay? So, because we talked about this a little bit before, I want to do, this ancestral vessel thing is important, and we just sort of blew over it before. I remember Ming was asking about it back in I think our first or second class. So what I want you to do is just for a second here, I want you to palpate your ancestral vessel, palpate it, and then I want you to, for just like a minute, close your eyes, and I want you to feel the pulse of your ancestral vessel with your index finger. Just take that pulse to your ancestral vessel, okay? Let's sit here for a minute. Okay, then come back. It's a really important practice to do. So I'm going to include this in our Min Jie meditations for this class, okay? Doing this ancestral vessel listening is really, really important. You can compare the two different sides. Compare those ancestral lines. How are they talking with you? What's the rhythm? What's the pulse? What are you feeling there? Do this a little bit every day, and all kinds of wonderful things can happen, okay? That's the ancestral vessel meditation for you to do, okay? So anyway, back to liver channel and the large intestine channel. That liver diversion channel diverges in the foot, goes up to the pubis, okay, and then connects with the gallbladder. And the large intestine diversion channel diverges from its channel in the hand, goes up through large intestine 15, and goes to the breast, okay? Then it goes up to the shoulder, okay, and goes into the spine at the nape of the neck and joins the large intestine and lungs, okay? And then another branch goes along the throat, goes up to the supraclavicular fossa, and then connects again with the normal large intestine channel, okay? Another branch descends from the clavicle to connect down with the lungs and the large intestine. So the liver connects with the foot, the pubis, the pelvis, the gallbladder channel up into the head, okay? And the large intestine goes hand, shoulder, breast, nape of the neck, shoulder, throat, neck along the throat, the lungs and the large intestine, okay? So again, we have this contrary motion, okay? Muscle channel, if we compare those, again, very complicated with that large intestine muscle channel, right? Because it goes up into the neck, then it goes, there's this whole thing where it crosses over the mandible, the other side, okay? And then it does a whole thing around the scapula, okay, and then up into the neck, and then converging up in the cheekbone, okay. So the liver basically goes to the foot, the genitals, and then it connects with the spleen muscle channel. The large intestine goes hand, shoulder, neck, then up to the corner of the forehead, remember, and then up the opposite mandible, down the scapula, the upper thoracic spine, the neck, again, okay, the cheek and the cheekbone, and connects with the stomach muscle channel, okay? So there's an interesting synergy between the liver and the large intestine muscle channels. Also, liver connects with the spleen, large intestine connects with the stomach. All of these crazy connections. All right, so I just want you to kind of let everything go, all of that detail. Let all that go for now. Just take a moment and try and imagine that complexity of that relationship between the liver and the large intestine. Both of those channels, okay? Open your eyes and look at what you drew on the page. Then close your eyes again, and I want you to feel what that relationship is. See it, feel it, connect with that channel relationship, okay? Try and get an idea of what the territory of this channel relationship is and what its domain might be, okay? And let all that go. So here we go into another emergent system. Now, again, we luck out on the convergent points. There's only one convergent point between the liver and the large intestine. Where is it? It's at do20. That is where they converge. So again, that's super easy. Not much to remember. So, but any herbs that we use that are going to connect with the liver and the large intestine using that Biajing relationship, it will have an effect on do20. So that's really powerful. And it's not a moderate connection that these things have with do20. It's really strong because the liver, we know, boom, comes up there. We always talk about liver and Bai Hui, right? But then we have that large intestine muscle channel going over the top like that, right? So it's very, very strong. Very, very strong connection. That large intestine forms almost a cap there, and they intersect in that way. It's a very strong motion. We want to think of all the channels and their dynamics in terms of a motion that's created, okay? Some of these motions assist each other. Some of these motions oppose each other, like that. That's how our body works. We have oppositional muscle systems that work around the axis of the bones through the joints. That's how we work. That's how we physically move through space, okay? So anyway, we're going to be focusing on Du20 as our point. Now, how many liver, large intestine herbs are there? There are 53 of them. There's a lot. So that's not so easy, huh? Okay. But what that does tell us, it's good to know that there are 53 different herbs that we could work with here, huh? But that tells us that that liver, large intestine, Beijing relationship is a really significant one, okay? And amazingly, we have a lot of tools to address it in a lot of different ways. So it's good news that there's so many, okay? But we'll have to break it down somewhat. Remember, always with our Min Jie, we're trying to break the complexity down into simple component parts, okay? How do we do that? Okay, remember, first thing we're going to look for, what are the pure liver, large intestine, Beijing relationship herbs? What are the pure ones, okay? Well, interestingly, there are only 4, okay? 3 of those 4 come from the clear heat, clean toxin category, okay? And 1 from stop bleeding, okay? So let's go into them here. Our first, Yadanzi, okay, the brucea fruit. Bitter and cold goes to the large intestine and the liver. Right? Bitter and cold, all through that channel. So we can imagine, wow, what's happening? We want to ask also why we have 3 from clear heat, clean toxin. So what does that tell us? Does that tell us that maybe there's a mechanism in this Beijing relationship that relates to removal of toxin from the body? I would think so. I would think this would be an important mechanism, okay? So maybe an herb like Yadanzi and these other ones that we're going to be looking at help in that process of getting the toxin out from the liver system. Something like that, okay? Here comes the next one. Oops, hang on. Keep you guessing. There we go, Wailing Cai. Again, clear heat, clean toxin. Again, bitter, neutral to cold, so it's not quite as cold. This one's not quite as cold. Right. So we're moving in a kind of a progression there, and then sure enough, our next one is Hongtong, and it's bitter and neutral, okay? So we go from really cold to neutral to cold to neutral, okay? So we have quite a nice range there, okay? But it looks like we're either gonna be going from neutral to cold in treating these. So it's telling me that we're gonna be using these herbs mostly for hot diseases, again, and mostly for hot diseases, huh? Or maybe we might, if we need to call on a tropism, since they're all bitter, okay, and they all enter the large intestine and the liver, okay, if we're talking about anything other than toxic heat, then we would want to use Hongtong to invoke this relationship because it's neutral. But anything else, if it involves a heat, more of a heat condition, we'd want to use either Wailing Cai as a first line or Yadanzi as a more intensive line. Or we might start stacking them up if we need even more power. So I hope that makes sense. Now, maybe we could use that Yadanzi for something like hot liver cancers, huh? Why? Because it clears heat, it cleans toxin, it cools the blood. It drains dampness and softens hardness, right? Okay, it's anti-parasitic, anti-malarial, anti-neoplastic. Yeah, Danza. So they use this basically as a cancer, which we could have predicted to some degree from that bitterness and the cold. the large intestine and the liver. So there's something that is very clear heat clean toxin about this channel relationship. This is how we learn. Okay. They also use it for dysentery. Okay, that makes perfect sense, right? Because that liver large intestine dynamic is often involved in dysentery. Okay. So they say especially with pus and bleeding. Okay. Or alternating hard and soft stools. Okay. They also use it for colon and breast cancers. And remember all those connections with the throat? It's used for hot toxic esophageal, stomach, cervical, or rectal cancers. Okay. And for malaria, remember we're always looking for malaria herbs. And these malaria herbs are going to become more and more important to us as we move forward in the future, and we start having more of these warm diseases as we overpopulate the planet more and more. Okay. So with a lot of these toxic herbs, you would this is like a toxic expelling herb. You would expect that it would be contraindicated in pregnancy. No one should have to tell you that. Okay, if we're doing things like blowing out toxins and cleaning stuff out, that's not what you want to do during pregnancy. Okay. Also because of its coldness. Okay, and because of its bitterness, also you want to be careful if you give it to somebody that has a spleen or a stomach deficiency. Okay. Also because of the toxicity, this has some toxicity, sometimes very toxic, they say. You have to be careful anytime you use a toxic herb if someone has a liver or kidney disorder. Okay? So we'd only use yadanza for very short-term use and in a low dosage if you're going to use it at all. Okay. But again, it's going to be an important herb as we treat these malaria-like illnesses moving forward in the future. It's really, really important. The toxin here in this herb is used to soften hardness. Okay, it's a toxic hardness, like with a cancer. Okay, not just some kind of an accumulation that salty might be able to take care of. It's a different toxic hardness. Is a little bit different than that. All right. The Wailing Thai. The Wailing Thai basically is used for damp heat in the liver and the large intestine. Okay, it clears heat and cleans and resolves toxin, cools the blood. It stops bleeding also. Okay, it expels wind dampness and cleans sores and abscesses. Okay, and the Hong Tongue focuses really on the intestines and the breasts. The intestines and the breasts. Okay, that's the Yang Ming aspect of it. Intestines and the breasts. Right? So it's used to clear heat, clean, resolve toxin, and it vitalizes the blood. If you look at it, you can tell it looks a lot like Jishui Tong. Vitalizes the blood, dispels blood stasis and swelling, and relieves pain. They use it for intestinal abscesses, particularly appendicitis. Also skin lesions with heat and swelling and pain. Okay, especially sharp pain from blood stasis. So sharp pain from blood stasis, particularly along anywhere in those areas that we were looking at. Okay. Okay. It's also used for joint pain. Pain from pelvic inflammation. Remember all those pelvic connections with the liver. Right. This is interesting. It says, as modern research says, it increases blood perfusion to the coronary artery and lowers platelet aggregation. So those are interesting things that we can learn about, not necessarily as a central issue for why we would want to use it, but it's good to know those things. Okay. Again, you're going to probably not want to use that during pregnancy. Okay. A lot of blood effects from that Hong Tongue. It comes from the red color. All these blood effects are coming from there. Okay. So now we have our fourth liver large intestine herb, which we also talked about yesterday briefly, is Huai Hua. So again, it's the same, right? It's bitter, but it's a little bit colder. Those are the same channels. They all go to the same channels, but they say this one stops bleeding more. Okay. And we would think because it's a flower that would stop the bleeding in the head. Right? But again, they use it for addressing the hemorrhoids a lot, right? So that's our balance system at work there. Mm-hmm. It's also bitter and cold. So what's really the difference? Okay, this is flour. Okay. So again, you'd imagine it goes to the head and the eyes, and it does. It's really good for nosebleeds, bleeding gums, that kind of thing. Okay, but its other effects are on the opposite end of the body. Okay, so it uses the balance dynamics. Okay. We know that it enters the blood aspect of the Yangming and Jueyin channels. Okay? So it cools blood and stops bleeding. Cools blood and stops bleeding, okay, especially in the lower jiao. Clears and cools liver heat and fire, quells fire, brightens the eyes. There's that hua, right? Brightens the eyes. Okay? They use it for hot bleeding disorders, especially in the lower jiao, especially for hemorrhoids, okay? Like that. They also use it, interestingly, to treat hypertension, okay? And maintaining the integrity of the capillaries. So it makes sense. In treating the hypertension, right? Because why we're trying to drop that blood pressure down. So it's using the opposite balance dynamic, okay? To help with the hypertension, right? So the bitterness is one way to stop bleeding, hot bleeding anyway, okay? Especially if there's liver tropism going on, okay? In these cases, strongly in the areas that the large intestine travels through. So that's what the stop bleeding part is about, okay? Okay, then now we start opening up Pandora's box here after we get out of the pure liver, large intestine herbs. We go into another area where they start including the lung, okay? They start including the lung with the liver and the large intestine. So all of these herbs are going to support both the liver and the large intestine because they both have relationships, okay? It's going to actually support the liver a little bit more, and it's going to support the large intestine and the liver equally if we look at the channel circulation, isn't it? So lung, liver, and large intestine. Lung is really going to be supporting both of those channels, okay? So one of them is Qian Li Guang. Again, it's still clear heat, clean toxin. Okay? And here comes another in that same line, all these lung herbs. Zhonglupi, okay, another stop bleeding one. Sebaye, another stop bleeding. Here's an interesting one, which is Songzhiren, the pine nut. It's the lung, liver, and large intestine again, okay, but this is sweet and warm. So we're switching from bitter and cool to sweet and warm to have a very different effect. One thing you want to keep in mind, that if your patient comes in and complains of having this weird bitter taste in the mouth that appeared out of nowhere, don't be too hasty in your diagnosis of that. Ask them, please make sure to ask them if they've been eating a lot of pine nuts, okay? Because there's certain pine nuts from China that wind up creating this bitter taste. Okay, it's probably from some kind of pesticide that they're using, I don't know what, but ask them, because I've had this happen several times. People start complaining of this bitter taste in the mouth, and it turns out that it has come from the pine nuts. That's just a tip that might help to save you diagnostically, okay? Here comes another herb. So this is this lung series. Okay. Liver, large intestine, lung, jin bu huan. Okay. So here we have sweetness again, like above, but also acridity. Okay. So it's a little bit more activating. Okay. This one vitalizes the blood because the acridity, it's vitalizing the blood rather than stopping the bleeding, which those two things aren't always contradictory. But here, plus the sweetness, it's supporting things a little bit. Okay. Just like that. All right. So then, after that in our series, it adds the heart. So it goes strongly down the vitalized blood tract, okay, by adding the heart in, okay, with the tauren. So that gives a much fuller effect on the upper jiao. It's got the lung and the heart both, right? So again, you're going to have that heart, dangling heart tropism, looking for love there. Oh. It's going to have a full effect on the upper jiao with this tauren because of that lung and heart connection. Okay, and then remember, you've got the large intestine and liver coming in the opposite directions through the sanjiao. So there's a lot of motion there. Okay. Then things move down to the middle jiao. So it goes from the heart to the stomach. Now lung and stomach, sangye. Okay, so you wonder why sangye generates so much fluid? It's because that lung and stomach connection, right? Remember what were we talking about before about whenever we hear lung and stomach, we also want to think liver and lung because that's where they're all converging in that area, right? So this is strong convergence in this area. Here we've got another one. It's doing something totally different than sangye, which is the chunpi. The chunpi. Okay, so now we have the bitterness plus some astringency and cold. So it's going to have a very, very different kind of effect. Okay, the astringency is more predominant here with this. Okay, so it's going to be closing things up, and a lot of cleaning is going on with that chunpi. Okay, and then next in the progression, we go from stomach to spleen. Okay, so that's going to emphasize the lung more with the wu mei. And it's going to emphasize that astringency more with the wu mei also, right? So we're working with the astringency, and now we're working with the sourness. So it's going to generate fluids through sour rather than generating them through sweet like we were up here with sangye. So you see, when we break down the channel progressions in this way, it reveals a bunch of interesting things. Okay. Next, keeps going along that line. So this is a little bit more in line with what we were doing above with the chunpi, right? But now we're transforming phlegm. So instead of using the bitterness and the astringency, instead, we're coming through the same area to transform phlegm with the sweetness and the coldness, that bichi, the water chestnut. Okay, like that. Then we go into full yang ming. Full yang ming, right? With the lung and the stomach and the spleen. Okay, so here we added the lung and the spleen. Here we added the lung and the stomach, and now the lung, the stomach, and the spleen. So you see, there are these embedded progressions when you start looking at the herbs in this way. So which way do we want to head? We want to do more spleen lung. We want to do more Stomach, lung, we want to do both, lung, stomach, and spleen. Okay, so different kinds of support contrasting with this basic Beijing relationship between the liver and the large intestine. All right. And then here comes another one. Same kind of channel associations, large intestine, stomach, stomach, lung, lung, spleen, spleen, liver, liver, right? But this is with the Mingfang, the alum. So this is super astringency, okay? Using the sour and the bitter and the cold is toxic, okay? You're not to be using this internally, okay? This is really taking that astringent idea and throwing all the channels, okay? Okay, then they ditch the lung and start focusing on the stomach, okay? So let's take a 5-minute break and then we'll come back and start focusing on the stomach. So I'll see you in 5.